values. So, and one of the things that we monitor closely to ensure that when patients come in here, they're safe and that their care is reproducible.
We looked at the entire system of what it was going to take to deliver quality care, and we kind of built that from the ground up. So when we started EHA clinics, we even looked at the facility itself. You know, how do we actually get a proper facility that has things like air filtration built in the air so that as sick people come into the clinic, they're not spreading their illness to people sitting next to them. Quality is not an endpoint, it's a journey, and it's a constant journey. So you can't ever say, okay, well, we've reached quality, now we're okay. It has to be this continuous improvement. So we invested a lot of time and money in making sure our staff became certified by the WHO.
We want to ensure that we are implementing quality systems throughout our organization, right from our primary healthcare clinics through our pharmaceutical distribution and every element of the business that we expand into. We are looking at development and opening new clinics in Abuja, in Lagos, and also in the East.
So what does the future hold for EHA clinics? The future of EHA clinics is really to access affordable, quality healthcare. If our dream came true, we would be in it. You know, we'd have at least 50 clinics, you know, in the next 5 years around Nigeria. We want to open up access to other parts of care, not just focus directly on the kind of primary outpatient care. We're looking at launching services to give people access to mental health, where that they can access their mental health and get counseling directly on their phone or on like via a website. The minimum standard of care should be access, affordability, and quality.
Hi, Baba, can you go on?
Oh, okay. Hello, everyone. Good afternoon and welcome to today's webinar. Today promises to be one. We have Dr. Nnemeka Igbonacho. We will be talking about enhancing access to patient care with telemedicine and virtual health care. Before we start, I would just like to give a brief introduction about EHA clinics. So EHA clinics is a leading primary health care provider with currently 4 locations within Nigeria. We have 1 in Lagos, 2 in Abuja, and 1 in Kano, and we are expanding from there. What to expect in this webinar? We would be introducing our speaker. Our speaker will be giving a presentation on virtual healthcare, and we would have a question and answer section as well as general Q&A. So our speaker today, our guest speaker today is Dr. Nnemeka Igbonacho, a medical doctor who obtained his MBBS from Madonna University in Nigeria and his master's degree in digital health and medical informatics in Germany. He is a professional member of the Healthcare Information and Management Systems Society, also a facilitator and co-founder for MedHelp Concierge Digital Health Technology. He is also the medical advisor on telemedicine, a Lear Active AG. He is also a patient advocate and clinical champion for Day One Healthcare Innovation Lab based in Switzerland. He is also a medical quality specialist for Ada Healthcare in Germany. And Ada Healthcare in Germany is an AI-driven technology company. So welcome, Dr. Nnemeka Igbonacho. Very good to have you here.
Thank you for having me.
Hello, Dr. Nnemeka.
Yeah, thank you for having me.
Yes, you're welcome. So you can start your presentation. I think we have enough people on the call, and we will take the question and answer session at the end of the presentation. Thank you.
Yes. Yeah, so today, like Dr. Baba said, promises to be insightful and exciting. Yeah, we're going to be talking about the topic, enhancing access to patients' care with telemedicine and virtual health care. So access in healthcare, it's one of the critical factors for healthcare, and access can be said to be the availability of affordable care to patients at the right time, that is when it is needed. So access has largely driven lots of innovations and research in healthcare, including technological advancements in healthcare and telemedicine and virtual healthcare, which we will be talking about today. But however, despite these advancements in innovation and digital technology in healthcare, the potential of digital health and digital technology in healthcare remains largely untapped. So this is an excerpt from the World Health Organization, and it's actually quite current. So despite the beautiful numbers and statistics and testimonials we'll be seeing around telemedicine and digital healthcare, there is still lots of work to do. There is still a lot to do to really leverage these potentials of digital healthcare. So before we go on, we would like to have a brief description of what telemedicine is. Telemedicine, actually, it's like one of the most described or defined concepts in healthcare as at the moment, with over 104 peer-reviewed definitions of telemedicine and numerous other non-peer-reviewed definitions. But one thing remains pertinent, like 3 factors remains underlying in all these definitions, which is healthcare services over a distance and telecommunications infrastructure. So here I also added medical education, because alongside healthcare services goes medical education. And in the course of the presentation or the discussion, we would see reasons why it's very pertinent to include medical education in this definition. And also telehealth is, telemedicine is a branch of telehealth that has been deployed to overcome issues of uneven distribution and shortage of infrastructural and human resources in healthcare. So we can all agree that it's a large driving factor for technological advancements in healthcare. So there are other concepts we would like to describe here, which is virtual care and telehealth. So virtual care on its own is like a broad term which encompasses various healthcare services that are administered routinely or through digital tools. And these healthcare services include video consultations. So video consultations are basically remote appointments where patients can connect with healthcare providers via video calls or teleconference platforms to discuss their symptoms, receive advice, medical advice, or seek treatment recommendations. Also in virtual care, we talk about remote monitoring. So remote monitoring also largely deals with monitoring patients' vital signs or post-operative recovery or rehabilitation progress using mostly wearable devices or other mobile applications, be it AI mobile applications or non-AI mobile applications. And this allows for proactive intervention and timely adjustments to treatment plans. So virtual care usually or largely empowers patients to take charge and drive their own healthcare. Also under virtual care, we'll talk about like digital health platforms. So these are like online platforms and mobile applications which provide patients the access to mainly educational and informational resources or personalized health information. Also self-assessment tools like symptom checkers. These platforms largely allows patients to engage directly with their healthcare managers and to help them make informed decisions as well. Now, e-prescriptions also falls under virtual care, and like we all know, is the ability to issue electronic prescriptions, eliminating the need for in-person visits just to obtain medication, especially in cases of refill medications. And also healthcare providers can send this prescription directly to pharmacies, and patients can also pick up or delivery made to them at their convenience. And this is quite accessible for patients. Now, mental health support, it's also a part of virtual care that has largely benefited from digital health or from telemedicine. So we can say that mental health is one of the wide adopters of virtual care. And in the digital health space, the so-called telepsychiatry. So this is usually virtual care. Virtual care has been very, very instrumental to expanding access to mental health services, mood trackers, through most times video therapy sessions, online counseling sessions or platforms, and other mental health apps. And then patients or consumers can actually receive professional counseling, therapy, and support from their licensed professionals remotely. Now, when we talk about telehealth on its own, it's a subset of virtual care that primarily focuses on clinical services such as diagnosis, treatment, and monitoring of patients. Now, these two terms, virtual care and healthcare, are interrelated, but there still exists some key differences in their scope, technology usage, and emphasis. So in scope, while telehealth primarily focuses on clinical care delivery and involves real-time interaction between healthcare providers and patients, virtual care usually includes both clinical and non-clinical remote healthcare services, such as digital health platforms and non-clinical consultations as well. So in terms of technology use, there are still subtle differences. Like telehealth, like we've talked about, is mainly clinical, and it relies on video conferencing, audio calls, using whichever platform that is deemed fit for that solution or for the practice, and remote monitoring devices also to facilitate patient-provider interaction. While virtual care, on the other hand, also encompasses a wide range of technologies, including messaging platforms like chatbots, mobile application, AI-powered solutions to deliver healthcare remotely. So we can say that telehealth is a subset of virtual care. Virtual care is like an encompassing term for them. And also on emphasis, like I've mentioned, the emphasis on telehealth places stronger on clinical care, diagnosis and treatment, and monitoring of medical conditions. Basically, it is typically used for healthcare needs that require direct or immediate attention from a medical professional, while virtual care includes clinical care and also focuses on promoting patient engagement, self-care, and access to non-clinical healthcare resources and information. So in the sphere of digital health and telemedicine, medical informatics, there are still other terminologies we would come across, and it's I would like to bring up like a few of them. And firstly, let's talk about mobile health. It's so the digital health world is such that there are lots of terminologies, and these terminologies are coined and defined by practitioners in a way that suits the use case for them. So you come across lots of definitions, but overall, there are basic principles that underlines all these definitions. So mobile health also refers to telehealth apps and service delivered via smartphones, tablets, iPads, and other forms of mobile technology with the aim of achieving improved health goals. And mobile health, also called mHealth, often doesn't really require the clinician unless there is need to transmit parameters or vital signs or results from such apps or such platforms to clinicians or healthcare providers to facilitate in decision making. Then e-health also is another terminology. Now, WHO described this terminology as a cost-effective and secure use of information and communication technologies in support of health and health-related fields, including healthcare services, health surveillance, health literature, and health education and research. So this is also a more encompassing term that transcends beyond telemedicine or virtual care. Anything electronically delivered in healthcare can be described as e-health, including insurance, surveillance, like we've seen. And then digital health now is like the umbrella term for all these terminologies or all these concepts in medicine. And it has a broad scope and includes categories like we've mentioned, such as mobile health, health information technology, the hospital information systems, lab information systems, wearable devices, telehealth and telemedicine, virtual care and professional medicine, also terminologies and terminologies that define electronic health records, standards and terminologies used in defining and programming electronic health records. So all this falls under the scope of digital health. There are many other definitions or concepts, but we can keep this discussion to this for now. So telemedicine, as we know it today, didn't actually start today. It's taken a while to evolve, and I would like to give some historical perspective of telemedicine. In the 1879, a Lancet journal reported the very first attempt at diagnosis through telemedicine, where a physician tried to listen to the cough or the nature of a cough of a baby over the phone to determine if that baby had viral croup or not. And then moving forward in 1959 was actually a groundbreaking event, which saw like the first use of a two-way video communication for telemedicine. So this was officially the first time there was a two-way video communication for telemedicine, which I would also describe what it means like when we come to types. So in this was actually done by the university clinicians in Nebraska, where they tried to transmit neurological examination to their students on campus. And then the 1960s saw a boost in telemedicine and digital technologies in healthcare through NASA and also the military. These were like the early promoters of telemedicine. When space explorations began, there was need to transmit physiological parameters from spacesuits to the doctors on ground so that they could monitor some of their events and what's happening with their health. Over time, throughout the 1960s into the 1970s and beyond, there were lots of projects undertaken by NASA in the US and even over in the US and our surrounding states there. And then in 1970, Thomas Bird was the one who coined the term telemedicine as we have it today. Now, all this has happened. Telemedicine has been in the fore. It has been with us all this while, yeah. But just only in 2019, 2021, 2022, there came the pandemic, the COVID pandemic, and that was what we described as the digital transformation in healthcare. So telemedicine have been used all this while for access to care to hard to reach areas in medicine. But during the pandemic, we saw other use cases of telemedicine. We were able to see that telemedicine could be used beyond hard to reach areas, but also even within the towns and the cities all around the world. So we have some transformative impact on healthcare, transformative impact of telemedicine on healthcare. So like I mentioned earlier, COVID-19 pandemic has, and its related services and its related service delivery restrictions generated like serious concerns for telemedicine use. And COVID-19 also provided us with the opportunity to actually analyze and assess the impact of telemedicine on healthcare in terms of like the performance, the quality, the access, and cost effectiveness. Yeah, so I would run through like a survey by OECD to determine actually the impact of telemedicine on healthcare. And this study used the OECD framework for healthcare system performance and measurements. So you could look at the diagram whereby the equity and efficiency of healthcare services were recorded. And then the primary care needs in terms of primary prevention, getting better, living with illness or disability, chronic care, and coping with end of life. These were all assessed in this study. So basically, it's also important to state here that there are certain limits to which telemedicine can reach. That means there are certain things that cannot be done remotely, and not all uses of telemedicine are effective or actually cost-effective. If telemedicine is used inappropriately, the services may lead to either increased workload for physicians, like we've seen in some studies. It could also lead to increased unnecessary care for healthier patients or patients who might not need those services, like we've also been reported in some studies. And also inappropriate use can also promote like fraud and abuse of data especially, and fraud within the healthcare system, and put strain on the government budgets or spending on healthcare. So the key thing here in telemedicine is firstly to understand what are those high quality value adding use cases of telemedicine that we should adopt and implement, and offer them to our patients or make them available to our patients. So that's very key and critical in implementation of telemedicine services. Now, I'd like to so in the OECD study conducted in different countries, but basically 9 countries, I tried to pick out like some beautiful numbers or statistics to show us the impact of telemedicine in healthcare so far, especially during the COVID period. So these studies were mostly done in Australia, or rather the figures I picked were those figures from Australia, Iceland, Canada, and the UK. So we witnessed the total number of consultations, and consultations here in this study refer to access to care of about 16% in April 2020, more than what it was in 2019. So basically, both in-person and virtual consultations or telemedicine use saw a peak in the attention-seeking attitude of patients in this study, which means it rose like the access to care by 16% overall, of which telemedicine consultations were like more than the in-person consultations. Now in Iceland, we also saw an unprecedented 45% increase in total number of primary healthcare centers and out-of-service consultations. Also in utilization and adoption, the same study for Canadian physicians saw that 84% of the Canadian physicians agreed that virtual care improved their patients' access to care. But meanwhile, 4 in 5 of those physicians experienced challenges while examining patients. These are some of the challenges with virtual care and telemedicine. And this goes to reiterate the fact that not everything actually can be done remotely. Then also on the patient side, 93% of the respondents in the survey were satisfied with the quality of the teleconsultations they had. 75% of them rating it as equivalent to the in-person consultations, and 96% of these respondents considered telemedicine use very convenient for them. Now, also in the same study, 60% of the patients recorded or reported cost savings due to telehealth consultations, and 77% of them agreed that telehealth appointments or telehealth consultations was good value for their money. Also in the same study, 51% of patients avoided traveling less than 15 kilometers, while 13% of the patient respondents could have traveled 150 kilometers if telemedicine services were not available. So that goes to show us that there are numerous benefits with telehealth consultations. There are numerous benefits with virtual care in terms of the shortening of time to treatment, cost saving for the healthcare practitioners and for the patients as well, convenience and all that. Now, a study that actually piqued my interest was that in England. So it stated that between April of 2020 and March of 2021, there was it's estimated that remote care, that's teleconsultation, saved patients 2.25 million hours of waiting time, and of which 99,000 hours of these were saved in urgent and care and emergency care. So this is just like, they're very familiar with health systems and all that. One of the major challenges in health system is cutting costs and diverting patients from urgent and emergency care to primary care, so to say. So this would be very interesting for the healthcare practitioners and health systems as well. There are lots of statistics here, but if you are very interested in looking at this and knowing the impact of telemedicine on health systems and health management, you could also look at the study from OECD survey on telemedicine and COVID-19 in 2020. It was done in 2020, 2021, but was published in 2022. So we can also talk likewise, as we've talked about the impact of telemedicine on healthcare. We can also talk about the impact of COVID-19 on telemedicine. So it's would I say rather fortunate or unfortunate that we are dwelling on COVID-19, because this was what saw the boom of telemedicine as we have it today. So we say that yeah. So 67% of the people in a study done okay. So in a study done on the impact of COVID-19 on telemedicine and virtual care, 67% of people in that study have used telehealth as compared to only 37%, which is about 50% increase pre-COVID-19 and post-COVID-19 or intra-COVID-19. And then the telehealth usage peaked also during the pandemic, with 16% of physicians reporting that all their patients were using it. So overall, the patient volume actually during the pandemic and the early stages of the lockdown decreased, but this overall is like a accumulation of both in-person and virtual care. So we actually saw a reduction in overall patient volume during that time. And this was because we are still learning about what COVID is, how we're going to handle it, what research do we need to do, what things do we need to put in place. So, but after that initial time, and then the health managers or the healthcare systems were a bit comfortable with how to handle COVID, then the patient volume also picked up and increased. And then 58% of the healthcare providers have a more positive view than they had before the pandemic on telehealth, telemedicine, and felt comfortable using it. Yeah, so we want to talk about like some virtual care and telehealth technologies, and there are numerous technologies we can use for virtual care and telehealth. One is like video conferencing platforms. So video conferencing platforms could be something as simple as a WhatsApp call, a WhatsApp video call, or something as complicated as a dedicated and secure video conferencing platform. So these days in most countries, like in the US and in Europe, they're actually advocating now for very secure and safe conferencing platforms. So in some clients, it's quite illegal to use social media platforms for health, for telehealth needs or for telehealth purposes. Also, remote monitoring devices. There are lots of remote monitoring devices. Basically, in medicine, we monitor like vital signs remotely. We monitor elderly patients. We monitor so many things. So there are lots of devices now, like the blood pressure checkers, the pulse, the full patient monitoring can actually be done remotely these days with some of these devices. Mobile applications, like I talked about in virtual care, we've seen a surge of lots of mobile health applications for telemedicine purposes and for virtual care generally. Now, in some countries, like in Germany, there is what is called like the reimbursement for using mobile applications. So this means that it's for every prescription or of mobile apps for health purposes, the doctor or the healthcare system or the developer of the app gets reimbursed for it. So these apps are being commercialized now. These apps are being like becoming a source of revenue to healthcare providers, and it's also adding value and solving problems in the healthcare space. Electronic health records, like we know, is something that has been widely adopted, notwithstanding that it still has its attending issues with some physicians and healthcare providers talking about wasting of time. And there is still a lot of work going on in that space to improve electronic health records or electronic medical records as we have it today. Now, AI-powered applications like chatbots, like symptom checkers, digital front door triaging systems, these are all virtual health and telehealth technologies. Store and forward, like I will also talk about when I talk about the types of telemedicine, there are platforms dedicated for that. Remote diagnostic tool, we've seen ultrasound, bedside ultrasound being done remotely now. We've seen advancements in radiology images being transmitted and used for diagnosis as well. So these are some of the things that even heart sounds and breath sounds being transmitted remotely with some of these tools. Now, types of telemedicine and virtual care. I'll be a bit careful on this because there have been lots of classifications of telemedicine based on different components, based on timing, based on who is receiving care, who is giving the care, based on technology used. But I would like to keep it very simple here. So firstly, I'll talk about so this classification is based on timing. We have the synchronous and asynchronous, and then the remote monitoring. So synchronous is also like real-time interactive, whereby the provider provides immediate medical advice to patients that require it. And here we make use of video and phone calls, platforms, and even chats and all that for this service. And then it can be used for initial consultations or follow-up consultations as well. And then asynchronous, store and forward. So this simply means that there is no real-time communication between the healthcare provider and the patient. So it uses a system whereby you record either a message or a picture or something and then send it to the provider, and the provider gets to see it at a later time and then takes an action or makes a decision based on the images or the messages you have sent. So in this case, you can also use it effectively for health education and for second opinion. So there are dedicated platforms, asynchronous, store and forward dedicated platforms where healthcare providers make use of to interact and get second opinion on cases, as the case may be. Also, remote monitoring. This uses like various technological devices to monitor patients' health remotely, and it's mainly used for follow-up in rehabilitation centers or after surgeries and monitoring of basically chronic diseases, which takes or spans a very long time. So the benefits of telehealth and virtual care, it's really numerous that we actually cannot exist it, but I've tried to enumerate some of them. And so there are different benefits to both the healthcare providers and the health systems, and there are benefits as well to the patients. Now, for the HCPs and the healthcare systems, we can talk about improved collaboration, like I talked with the asynchronous store and forward platforms, where you have dedicated channels where physicians, laboratory scientists, pharmacists, and other healthcare practitioners collaborate to offer the patients a holistic care. Also, early detection and intervention. Now, like we saw in the statistics, the use of telehealth and virtual care services saw a surge in the access or in attention-seeking behavior of patients. This could lead to early detection of diseases. Ordinarily, what's something a patient or a consumer might not seek advice for or might not seek medical care for, but because of the convenience of telehealth and virtual health care, he or she would be able to seek advice early, and then something might be found early and interventions also taken appropriately. Improved health outcomes, of course, and then cost effectiveness. Now, there's been this debate on, is telehealth or virtual care really cost effective in healthcare? I would say yes, but not immediate. So we talk about like long-term cost effectiveness of telehealth. Yes, you will agree that the implementation of these solutions are really, really, really cost effective. But in the long term, you will find reduction in service time or care time. You will find reduction in certain services that actually make use of much higher healthcare expenditure like emergency and urgent care. So you find out that in the long run, this would curtail some of these excesses in healthcare and eventually save costs. Continuity of care, also efficiency of care services with telehealth services because of the convenience and all that. And also enabling to expand patient base. So again, convenience is a very key factor here because these days people are trying to drive their own healthcare and make sure that they have this affordable and quality care at their own convenience. So when a clinic or a practitioner offers such services, you find out that it would spur patients to come to him or her or that particular facility, and then you will have to, or you would eventually expand your patient base. Also, for the healthcare providers is a very important benefit, maintaining a work-life balance. These days, we've seen surge in physician burnout and practitioners burnout in different countries in the world. And it's something that has raised a lot of concerns in the healthcare industry. So this is also a very important benefit to telehealth, or rather of telehealth and virtual care. Now, for the patients who have improved accessibility, enhanced convenience, personalized care, people are trying to drive and own their healthcare with telemedicine and virtual healthcare. People get personalized care in terms of the digital front doors triaging patients to appropriate care in terms of the electronic health records. Sometimes patients already take the practitioners or the health clinics take some history before the patient comes or before the patient is attended to. And this helps to actually offer personalized healthcare to the patient. Extended care for the patients also, and minimizing exposure to infections. Like we all know, for every visit to a clinic or to a healthcare facility, there is this risk of picking up some infections from there. So this goes for the physicians as well, like we all saw during the COVID-19 pandemic. Now, choosing a telemedicine or virtual care services for your health needs. This is very vital to this discussion. Like we've established, not everything can be done remotely, or not everything can be done with telemedicine or virtual health care. So what do you need to do as a healthcare practitioner or as a healthcare or as a health system to ensure that you choose the right solution which is fit for purpose for your practice and offers the best for your patients? Now, you first of all have to look at the type of telehealth services the type of healthcare services you offer as a health system or as a provider. Like we've established in the course of this discussion, there are some clinical specialties that have been early adopters and promoters of telehealth, like radiology, dermatology, pathology, mental health, and all that. So you would want to look at the type of healthcare you offer, the demographics of your patients as well. So if you are offering, I give an example, geriatric care to the elderly in a low-income society, ordinarily, this should be one of this population should be one of the beneficiaries of telehealth. But with the demographics, low income, you would know that you would have some issues reaching them via telehealth. So if you're offering such services and you want to offer telehealth services, you would have to be very careful and make sure you apply the right solutions to give your patients or your clients the best. Also, personnel is something, human resources. Yeah, like we talk about telehealth and digital healthcare, it has also seen the need or the fact for physicians and healthcare practitioners and people that work in healthcare facilities to up some of their skills. For you to effectively offer such services, your personnel has to be trained and even retrained and have continuous training on the use of these technologies and all that. Then also the technology and infrastructure is also a very vital point. like I usually say, it's not about just developing a digital health solution, but it's about developing the right solution that is fit for purpose and fit for markets. Now, there are some things that go alongside healthcare technologies, stuff like the network infrastructure, the hardware itself. So you need to make sure that you have all these infrastructure, both hard and software, in place before you start talking about telemedicine or virtual healthcare services. Also, characteristics of your patients, like I talked about, is also a very vital factor. You need to look at what type of patients you handle or what type of clients you handle. Are they people that would opt or adopt telehealthcare services? Are they people that really need telehealthcare services? So these are some of the things you need to put in place and look at before you offer such services. Also, the legal and regulatory requirements. There are tons and tons. As digital technologies are developing in healthcare, tons and tons of regulatory and legal requirements are coming up, which we are still even learning as it evolves. So your offerings would have to, where societies that have such regulations, you must have to adhere to the best practices to offer such services. Now, also transitioning to telemedicine, like I described earlier, it's a relationship between three pillars: the provider, the technology, and the consumer. So each of these aspects must have to be satisfied for you to effectively or smoothly transit to the use of telemedicine within your practice or your healthcare system. For the provider, they first of all must accept it before it can become a thing for you, and also increase revenue. Most healthcare systems are for profit these days, right? And then you wouldn't want to develop a solution or adopt a solution that would increase your revenue. Rather, you should be aiming to, sorry, that would not increase your revenue. Rather, you should be aiming at such technologies that would increase your revenue and lower your cost of services. Technical proficiency as well, like I mentioned earlier, from the providers. Your doctors, your physicians, your healthcare practitioners have to be trained and also have the right technical support to make sure that you have a smooth running of your platform. The technology itself must be available and acceptable. It must be efficient. It must be compliant with regulatory standards and fit for service. And above all, the technology has to be safe for the patient. So this is a very big factor in the telehealth or digital health world now: patient safety and ethical use of AI and digital technologies in healthcare. Also, the consumer's needs must be met by your service. They must have a feel of satisfaction, and it must be easy to use, because no consumer wants to have an extra burden while you are suffering something or you have an attending health issue, and then it's being added to by the use or navigation of this system. So it must be easy to use and usable for the consumers. And of course, they must accept it. It must be convenient to them, and they must trust the source of this. So this is where the healthcare providers have a lot of work to do, because if your patients does not trust that their data is safe with you or that their medical information is safe with you, they would not adopt this offering. Now, leveraging telemedicine to transform Nigeria's healthcare sector, something I tag the brain gain. So it is no longer news that there is a global shortage of healthcare professionals worldwide, and it's a very big problem, right? So what do we do? How do we tap into this telemedicine or digital technologies in healthcare to improve access to care? Now, I would want to lean towards primary healthcare, and I'll give like an instance or a case study. So we can all agree that primary healthcare, to some extent, would function well virtually, right? So we have a lot of exodus of healthcare practitioners leaving the country, even where they are living to. Some of them, they are also living to another countries, right? So, but if we have a case whereby we have a system that these healthcare practitioners can be interconnected, you will see that there will be a level of collaboration no matter where you are. Geographical location is not a thing. In fact, that's what is trying to be addressed with telehealth. So you could be somewhere in the world and another place and another physician in the world is offering you healthcare, right? Who might be a physician or a healthcare practitioner of origin of the same country where you are. So if we improve our telehealth offerings in Nigeria, we can actually have some of our healthcare practitioners still practicing as healthcare practitioners in the country. Now, also to shorten time to care, this is something that we can leverage on, like we saw in the study, the OECD study, that the time to care shortened a great deal. And also enhancing training and continuous retraining of healthcare professionals. So telemedicine, like I talked about in the definition, health education is also a very big factor and component of telemedicine. So with telemedicine, we could have trainings cut across different parts of the world and then have our healthcare practitioners very well trained and ready for the task ahead. So given a use case of telemedicine, I would want to be a bit fast here. So let me just create a scenario. So there is a doctor-patient consultation, there is a healthcare provider communication, and there is a patient feedback or follow-up. So a physician within a hospital or a clinic can have a video conferencing platform where he takes medical history to some extent. Some examination can also be performed remotely. And after this, probably, or maybe he or she is not certain about what a diagnosis is yet. So with digital technologies or telemedicine and virtual healthcare technologies, the physician or the healthcare provider can seek further opinion from fellow healthcare providers. If it's with a laboratory, he or she can request for ancillary investigations via the EHR platform or via telemedicine platforms, and then the test is done, and he can also or she can make e-prescriptions on the same platform, and the medication is delivered to the patient or the patient picks it up. So there are dedicated platforms being developed every day by different vendors for this kind of setup. And I believe in EHA Clinic, we have such as well for effective communication between the patient and the doctor virtually, between the doctor and other healthcare providers, and also a feedback channel for the patients to either get to a facility for further examination, or it could be like a drug is prescribed and then the patient gets it delivered to him or her or picks it up. So I would also like to enumerate some examples of successful telemedicine and virtual care solutions. So we have like screening and engaging patients remotely before they enter a care facility. So this is what we mean by digital front door. A lot of health systems around the world now incorporate digital front door into their health systems. So before a patient comes into the hospital or the clinic, he or she has been triaged by the digital solution to channel them to the appropriate care where they need. Also supporting the acquisition of medical images remotely. Lots of work has been done there with the PACS, DICOM, where radiological images can be read or analyzed by different radiologists from anywhere in the world, and the reports made available to the treating physician. Also bringing ultrasound expertise to the bedside through live remote collaboration. We've seen companies develop such solutions, and keeping an eye on patients with wearable sensors. So this is something that is on a very great exponential growth. Wearable sensors, lots of tech companies, health tech companies are veering towards these wearable sensors, and a lot of development has been done. So this is something that has helped the healthcare system to a great deal. And also organizing critical clinical trials for drug trials, remote surgeries through Da Vinci robots, although these is still judged as very expensive, and not all centers or all countries have the capability to do this. But this has been successfully carried out in some places. So challenges to implementation, like we talked about earlier, data security and privacy. Healthcare is tightly regulated. So for a user to be confident in making use of your telehealth offering or your digital technology offering in your healthcare practice or system, you must conform to security and privacy regulations. So this could pose a lot of challenge, especially in the Western world, where people are very particular about their data and privacy, and especially when it comes to health data. These are very sensitive data. So this has seen a lot of resentment to adoption of telehealth services, both from the practitioners and the patients as well. Impaired provider-patient relationship. So some physicians and some healthcare practitioners would also agree, and even some patients will also agree that the communication with telehealth and virtual care services is not as smooth as it is in person. But when done well, and when the both parties are adequately trained to use it effectively, you find out that this challenge would be averted. Also, they require technology and expertise. Like I say, digital technologies, digital healthcare requires a lot of resources to set up. It requires a lot of expertise, both from the healthcare providers and from the technical crew. So this can pose a great challenge to implementation of some of these solutions. Implementation cost also and acceptance. These are some great challenges to them as well. Now, policies and regulations, it would be very nice to at least talk about or enumerate some of the policies that exist within the digital health sphere. Now, I'll talk about the HIPAA, which is the Health Insurance Portability and Accountability Act, but mainly domiciled in the US. We have the European Union Medical Device Regulation. We have the General Data Protection Regulation also for the EU. And then in Nigeria, we have the Patient Rights of Bill, Nigerian Data Protection Act. And then we have this framework, beautiful framework of the Ministry of Health in Nigeria on digital health. So if you go through these documents, you'll find out that there are lots of regulation towards digital health. There are lots of regulations towards AI. There are lots of regulations towards telemedicine and virtual care. And the ultimate aim of all these policies and these regulations is for ethical use of technology in healthcare. Because if it's not regulated, there will be lots of casualties, there will be lots of incidents for the patients, and that is not what we want to see for or have for our patients. Now, future trends in telemedicine or in digital health generally. So expansion of remote monitoring with advancements in wearable technologies, Internet of Things, devices, integration of AI and machine learning, large language models now being, in fact, almost all the digital health companies are gearing towards AI and large language models. So because it has been shown that with training of some of these models, they have even performed, or they could perform even better than physicians in some studies as claimed. Now, virtual reality in healthcare is also something that is springing up very well. Virtual reality, augmented reality, robotics also. These are the future trends or the things we would be looking out for in digital health in the future. Also, regulatory challenges and reimbursement policies, like I talked about in Germany, where you now have reimbursements for apps, digital health apps being prescribed by physicians and being receiving reimbursements for such. Telemedicine for preventive care also, this is something we would expect large positivity in the future. Also, hybrid care models. So this is, yeah, like I explained initially in the one of the related terms. So hybrid care models, like this, we all know digital health or telemedicine cannot be used for everything. So hybrid care is like combination and application of all available treatment or care models. So it could be in person, it could be virtual care. So we've started seeing scenarios where some of these things are combined, a treatment or starts with telemedicine and then ends with in-person. So this is also acceptable and is gaining a lot of momentum in the digital health space these days. Also enhanced telecommunication infrastructure. So in as much as this drives digital health is also driving telecommunication infrastructure because there are some offerings like the Da Vinci robotics in healthcare, which needs very good 5G and even more bandwidth for effective use. So this also drives development in that area as well. Now, I want to end with saying that while telemedicine and virtual healthcare can be leveraged to enhance patient access to quality care, we need to be very careful in planning it before we merge into our practice. So when we fulfill the necessary legal and regulatory requirements and implementing solutions that are fit for purpose, we can overcome the attendant challenges encountered while adopting technology in healthcare. That's the end of my presentation, and thank you for listening.
Thank you. Thank you very much, Dr. Nemeka. So good to hear all of these wonderful things about telemedicine, telehealth, and our listeners have questions. I think we can start with the first question.
Okay.
So the first person, Rosemary, would like to know what happens when there is no improvement in patient's condition after a telehealth consultation.
Okay, yeah, so the thing would be, what was the consultation for? Like even in in-person visits, right? We've seen scenarios where there was an in-person visit, even a hospital admission, and after that, there is no improvement, right? So a lot of things could be wrong. A lot of things could have played in. It could be like maybe wrong diagnosis, it could be wrong information, it could be wrong treatment plan, right? So it's all about looking inwards at what was done and what needs to be done further. So like I emphasized in this presentation, telemedicine can, or not everything in healthcare can be done remotely. So if you as a practitioner have seen a patient and you feel that the patient's outcome is not as good as you expected because you did not properly examine or because you could not offer the appropriate treatment, then you should request for probably an in-person visit or for a referral or for a specialist care, because we also have like platforms that offer tele-specialist care like cardiology, nephrology, and the rest of them. Yeah. So it's all about analyzing what was done and identifying the main factor or the main reason why the outcome for the patient wasn't better or was not optimal.
Thank you very much, Dr. Nemeka. Just to add to what Dr. Nemeka has said, not every medical consultation can be attended to via telehealth consultation. So for emergency cases now, for example, someone is having a form of respiratory distress, that is not the time to start looking for a telehealth consultation. And if for any reason there needs to be a telehealth consultation at that point in time, it is to screen just to screen the patient to know if this patient would need maybe home care consultation or this patient would need to be rushed to see the doctor immediately. So thank you very much, Dr. Inemeka. The next person, Telma, is saying, are there telemedicine links or platforms for medical doctors who are interested in taking up virtual healthcare?
Yes, actually, there are, and I've seen quite a few of them in Nigeria. Currently, I'm also working on developing something in that regards, because like I said, it's about, in one of the slides in the presentation, it's about leveraging telehealth to improve the healthcare system in Nigeria. Yeah, so it is something that that is welcoming. I've talked to a lot of physicians about it, and the perspective or the acceptance to it looks quite promising. And I will encourage those who can to adopt it. Like Dr. Baba said, primary health care can, to some extent, effectively be done via telemedicine. So some of these platforms exist. Yeah, I've seen a few of them in Nigeria, but I would say it's still not very much optimal as the way it should be. So I would expect that in the coming months or years, we would have more of such platforms, and then have doctors sign up to them and offer their services via such platforms.
All right, thank you very much, Dr. Nemeka. This person can also reach out to us. We have we currently run a telehealth platform, both internal and external telehealth and telemedicine platform, and we are actually looking on to bring up doctors that are interested, and then have them incorporate them into our system. So this person can reach out to us via our website or the command center number. Just click on our website and then you get more information with regards to this. Then Dr. Nemeka, this same person also wants to know if there are free online courses or trainings to improve our delivery of healthcare virtually. I'm interested.
Yes, there are tons of resources online to, first of all, make you aware that such thing exists, and then put you in the right perspective or in the right mindset to adopt them. There are lots of them. Yeah, and I might not be able also to like give you links now, but it's something probably maybe you could also contact like AHA or contact me directly. Yeah, or I can furnish you with some of those links or resources. There are universities that offer like short courses for such things. And there are also learning platforms, not universities, other online learning platforms that offer them. So in the appropriate space, we can actually, or I can furnish some of these resources to you or the person that is interested in that. Yeah.
Okay. All right. Thank you very much, Dr. Nemeka. We'll be reaching out to you as soon as we get
Yeah.
details of what the person actually wants.
Very good.
So another person wants to know, the person said, thank you very much. This is Obina. Thank you very much for a beautiful presentation. How can one pursue a career in telemedicine? Okay, I think that's what you already highlighted with regards to what the previous person discussed. Or would you like to throw some more light?
Yeah, I would also like to put a light on it too. So
All right.
pursuing a career in telemedicine, would you mean like being a physician or a healthcare provider that offers telehealth services, or would you mean a healthcare practitioner or provider that wants to have a shift of career into digital health? So whichever way, it's fine, it's good, right? So if I'm to talk about like the second one, right? So there are lots of physicians these days moving into digital health. And I would say it's a very promising and interesting career to be in. And the way you can actually launch into it is by learning. There are different programs like I talked about earlier. You could start with probably some short courses on some online resources, and then advance into maybe a degree, an appropriate degree towards it, and even a higher one, and then training yourself in skills. So you talked about like telemedicine, but I would say it's not really like telemedicine specifically. So you could talk about like digital health or informatics, bioinformatics, medical informatics, public health informatics as a whole. So these are there are lots of career opportunities there, and is something nice to also look into. Yeah.
All right, thank you very much, Dr. Nemeka. Also to add to that, if you have more questions, you can join the EHA Clinics Academy. The link is has been pasted on the chat session here, kindly join the link and then make all your inquiries, and we'll get back to you as soon as possible. There's another one here. EHA Clinics is doing well at advancing healthcare, but I doubt the readiness to invest in the digital technologies that facilitate healthcare. I hope that facilitates telehealth. I hope this also works in the public healthcare facilities. Dr. Nemika?
Um, that might not sound like a direct question. Yeah, but in public health facilities, yeah, of course, like in one of the definitions I gave on e-health as defined by the World Health Organization. So we talk about like surveillance, disease surveillance, talk about like monitoring, we talk about insurance and all that. Yeah, so these are all public health aspects, and there are a lot of digital health offerings in that space. Like the WHO have like now a full-blown department on medical intelligence and epidemics, domicile here in Berlin, and they are doing lots of work and working with lots of digital health tools, especially in surveillance and tracking of diseases and the trends of diseases. So yeah, in every aspect of healthcare, public health, health insurance, health management, there are some perks of digital health happening in every area.
Okay, thank you very much, Dr. Nemika. So I think just to add to what you have said, another thing about, I'm talking about our environment. I think another reason why, this person might be doubting the readiness to invest in digital technologies within our community would also be as a result of the acceptance, right? So my experience in medicine, in general practice here in Nigeria, has been that a lot of people are not willing to really accept the telehealth and telemedicine platforms for reasons best known to them. But the commonest ones have been technical know-how and then cultural and personal beliefs. So in your own practice, what has been your experience in Nigeria with regards to telehealth and telemedicine?
Yeah, okay. So 2 years ago, yeah, I conducted a study on something similar, leveraging digital technologies in improving access to care in Nigeria. And it wasn't shocking, yeah, but the results were in tandem with what we saw in the publication from OECD today. So I found that a lot of physicians, now on the physician side, or healthcare practitioners, a lot of healthcare practitioners are beginning to accept and adopt digital health technologies. So telemedicine, clinical decision support systems, and electronic health records. These were like my 3 focus areas for the studies. And a lot of healthcare practitioners are beginning to accept that, including health managers, because they revealed that it saves them time, it saves them money, it helps them to even acquire or keep more of their patients. Yeah. So like we have the digital transformation with the COVID pandemic, the figures pre the pandemic and the figures post-pandemic cannot be compared. There's been a lot of increase with what I've seen or what I found in the research. And then on the patient side as well, I also conducted a study, a survey, not really a study, on patient acceptance. So 3 things were the driving factors for patients. 1, convenience. 2, costs. Yeah, so if we have solutions, or when we start developing solutions that would be really convenient for patients, like I mentioned, not even adding to the burden of technical expertise and know-how for the patients, but rather increase like convenience for them at their convenience in their home. They can get everything done. They can speak to a doctor. They can get their labs done. They can get their medications delivered. Yeah, so, and if this would come at a reasonable cost or at an affordable cost, they would be willing to adopt it. So that's what I found in Nigeria, at least in the last 2 years ago. Yeah.
All right, thank you. That's really interesting. I guess we are getting somewhere. Then there's someone here asking, Ndubisi is asking, where would the patient be while the sample is collected and lab results communicated in real time?
Yeah, okay. So again, it depends on the kind of platform you have, right? So in Nigeria, I've also seen some lab services, some e-health lab services where the patient either comes in and then sample collected, or the lab now goes to the patient in their office or their home at their convenience, yeah. So anyone is fine. The samples can be collected. Of course, some very technical like samples, the lab scientists would know more about that, might not be able to be collected at home or that, yeah. But for most of the investigations or samples that will be taken, could be taken at home or at the patient's convenience. If we have such systems or such laboratories or such healthcare platforms that offer the services, or it can also, the patient can also come in and then the sample taken, and then, I mean, when the sample is taken, you really don't have to be there while the result is being, or the test is being done and the results being collated. Yeah.
Yeah, thanks, Dr. Nemeka. Just to add to what you are saying, because of course, EHA clinics, we currently run a digital health platform where we also leverage on the telehealth and telemedicine our platform as well. So we do this. We get patients that call for telehealth consultations, and that's why, like you mentioned, there needs to be a form of collaboration. All of these services need to speak to each other. So if you are providing a telehealth platform, you should have collaborated or partnered with a mobile pharmacy or a lab that can, perform home care sample collection. So that's what we do after the telehealth consultation. And if there's a need for collection of sample, there's home care sample collection. We send the nurse or the lab scientist to the patient's home in the comfort of the patient's home, and this sample is collected. And there are also other platforms available out there in Nigeria here, by the way. What they do, they have paramedics that are trained. They just go to people's homes and collect samples, send them to the lab, and the results are sent through emails to the patients. So that can also be done. So I don't think we can take, we'll just take like two more questions and then round up. If you have more questions, you can you can join our Doctors Academy platform. You can ask questions there. You can also send questions to our email. I think Obina has dropped it in the chat box below. I will take two more questions and then we'll call it a day. Thank you, Dr. Nemeka, for your patience. So this person, Ishak, is saying, thanks a lot, Dr. Nemeka, for your great presentation. I would like to, sorry, what's this? Yeah, sorry about that. Okay. No, sorry, it's not Ishak. Ikra, sorry. Thanks a lot, Dr. Nemeka, for your great presentation. I would like to ask how the digital literacy of patients can be improved in low and medium income countries. Because literature suggests that this is one of the leading limiting factor for telemedicine implementation. Dr. Emeka.
Yeah, digital literacy, digital divide, it's a very big problem, especially for low and middle income countries. And the way that we can handle it, so to say, is advocacy. Yeah. So one, we need to talk to the people. We need to kind of do some social engineering towards a mind shift or a perception shift. And then not only having some social engineering or advocacy, also make these solutions or make the enablers of these solutions available and affordable to them. Yeah, so I give an instance. You have someone in a rural area in sub-Saharan Africa or Southeast Asia, and this person doesn't use a smartphone, and then you are bringing digital technology in healthcare to the person. You are offering like a telehealth service, or you're offering a mobile health service or something like that. While this person does not have a smartphone, while this person probably does not have a good internet connection, right? So you have to start from the basics first. Expose this person to the use of internet, and then expose this person to the use of smartphone or tabs or other tools that enables digital technologies in healthcare. So these are things that you need to do first before you can now introduce your digital health solution. So underlying factor there is about making available the resources, and then advocacy, talking to the patients, like talking to the people or the population, because it's not going to happen overnight. Like if we can remember vividly, one of the factors in the definition of primary healthcare by WHO is acceptable technology. So this technology must be known and acceptable to the population before they can accept and use it. So there needs to be lots of advocacy and education in that regards.
All right. Thank you so much, Dr. Nemeka. Thank you for your time. Thank you for the beautiful presentation. That was really, really, really well packed with lots of information. And thank you to our listeners as well. Thanks for everyone for joining. We hope that we'll meet again next month to have a more robust conversation on another interesting topic. Please feel free to reach out to us at EHA Academy, EHA at academy@eha.ng. You can also check out our website at www.eha.ng. You can also reach out to our command center to make inquiries about telehealth consultations and how you can benefit from it and experience a telehealth consultations. Thank you very much and enjoy the rest of the day. Bye.
Thank you. Yes,
Thank you, everyone. Bye.
Bye.